gents get more infection in the prostate, in the bladder and in the urethra, in the lower urinary tract, whereas females also get infection in the bladder and urethra, but sometimes for some strange reason ascending urinary tract infection is more common in females, and you can get maybe 2 or 3 cases every month admitted to ICU because of ascending urinary tract infection. And I saw a lot of patients in UK, young ladies getting ascending urinary tract infection, shivering, going into sepsis.
सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में।
हेलो एवरीवन, नमस्ते, वेलकम टू सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में। मेरे साथ है डॉक्टर निखिल।
नमस्ते।
तो हम काफ़ी डिस्कस कर रहे हैं
यूरोलॉजी
कंडीशंस के बारे में, जिसमें हमने प्रोस्टेट डिस्कस किया एंड देन हमने डिस्कस किया स्ट्रक्चर। आज कौन सा बात करने वाले हैं?
नहीं, अभी रिटेंशन ऑफ यूरिन मतलब इनएबिलिटी टू पास यूरिन, वो सिम्टम के बारे में हमने बात कर चुके हैं। अभी हम बात करेंगे इसके बारे में, ब्लड इन द यूरिन। ओके, सो ब्लड इन द यूरिन basically is a dramatic symptom, and generally patient will come because they are scared when they see blood in the urine. Okay, so what is the type of blood in the urine which you should be worried about?
Right.
Can you tell me what it could be?
No.
Okay, see, I will give you a hint. Blood in the urine can be broadly of 2 types: blood in the urine with pain, blood in the urine without pain. Which is more worrying?
Without pain.
Why?
क्यों हो रहा है?
So with pain क्या है?
I mean, I don't know. For women, maybe it could be because of the menstrual cycle.
No,
I don't know.
So basically, blood in the urine, you're right, blood in the urine with pain generally is 2 conditions. Either it is a stone or it is infection. Okay? And if it is stone, then the pain might be anywhere in the urinary tract, depending where the stone is. If it is in the kidney, the pain could be in the loin. Then if it is in the middle of the ureter, it could be more in the groin. And if it is lower down in the bladder, it could be in the region of the, just below the umbilicus, called suprapubic region. Right? So pain will be in that region where the stone is. So stone can be basically 3 organs: in the stone, in the kidney, in the ureter, which is the tube between the kidney and the bladder, and it can be in the bladder. Alright, so that is one. Now in the bladder, the patient will have more irritable symptoms, like the what we discussed in prostate, the irritation symptoms. Patient will feel like passing urine again and again, and he will have pain at the end of passing urine, because when the urine is there, the stone is floating in the urine. Once the urine goes out, the stone touches the bladder directly and causes irritation. And because it is like this, the bladder, and the most sensitive part, that is the trigone, is in the floor of the bladder. So the stone will lie in the floor of the, so it will touch the trigone and keep, giving a sensation that he wants to pass urine or she wants to pass urine. Okay. Whereas the stone in the ureter will be the classic stone, which is pain coming from behind towards the front. And the stone in the kidney will be more like a pain at the back, but not associated with this frequently wanting to pass urine. Okay, that is one. If it is infection, again the symptom like bladder stone, they will want to pass urine frequently because the bladder is irritation. Irritation is there in the bladder, irritability because of the infection. So patient feels like passing urine again and again, and every time he passes urine or she passes urine, there is burning or scalding sensation in the urine, because it causes a kind of different kind of pain, or what we call it, there's a word for it. It is called strangury, Strangury. Strangury is the name of the symptom, which is scalding pain throughout the act of passing urine. Because the infection may be in the bladder, it could also be in the urine passage. So when the urine is passing over this inflamed tissue, it causes pain. So the type of pain in a bladder stone which is pain at the end of the urine, and in infection is the pain is throughout the act of passing urine, is slightly different. And third thing is, if there is infection, patient may have chills and fever also. Okay. Of course, commonest site of bladder urine infection is in the bladder, but you can get ascending urinary tract infection which goes up to the kidney. Then it becomes a serious problem, and such patients are more sick. They are in sepsis. We had discussed long back, septic, if you remember.
Yeah.
So if the upper tract, that means the kidney is infected, which is common in ladies, more common in ladies than gents. Gents get more infection in the prostate, in the bladder and in the urethra, in the lower urinary tract, whereas females also get infection in the bladder and urethra, but sometimes for some strange reason ascending urinary tract infection is more common in females. And you can get maybe 2 or 3 cases every month admitted to ICU because of ascending urinary tract infection. And I saw a lot of patients in UK, young ladies getting ascending urinary tract infection, shivering, going into sepsis and needing IV fluids and ICU kind of treatment with higher antibiotics and things like that. Whereas the lower urinary tract infection, you can treat them as OPD patients, you know. So this is one. Now, without pain is generally a tumor. Okay, and the commonest tumor is in the bladder. The second common site is kidney. Ureter generally cancers are less common, so you can either get a kidney cancer or a bladder cancer. The commonest is bladder cancer. Kidney cancer also presents with blood in this, so you have painless hematuria. Hematuria means blood in the urine. So painless hematuria can be renal cell carcinoma, which is the commonest type of carcinoma in the kidney, or a villus papilloma, which is the type name given to the bladder cancer. Villus means what? It is like the, you see in an aquarium these deep sea diving, you will see these frond-like things.
Yeah.
Exactly, it looks like that. Okay, it looks like a frond-like thing. Now the villus papilloma, if it is over 5 centimeters, any mass anywhere in the 5, whether it's in the kidney or in the bladder, is unless proved otherwise treated as malignant. If it is a smaller papilloma, villus papilloma in the bladder, it could be between malignancy and not malignancy. But one of the things which is common to the bladder tumors is that there is a high chance of recurrence. High chance of recurrence. Okay, so let's come to what are the investigations you do. The first thing you do is a urine test, which will show blood. You also do urine culture, which is it takes 3 days, where you culture the organisms that are present in the bladder and what drug is working on that. So it's called culture sensitivity. So you collect the urine in a sterile container and do culture sensitivity. That will tell you whether there is urine infection. So the definition of urine infection, it should be culture positive. Just having pus cells in the urine is not enough, because when blood is in the urine, blood contains white blood cells, so it will show pus cells, it will show RBC. That doesn't mean it is infection. You understand? Because blood contains both RBC and WBC. Now, if there is no blood and there are WBCs, yes, it may indicate infection, because urinary tract infection can come without blood also, just with symptoms of frequency, pain and fever. But if there is blood, then the WBCs are because of the blood. So culture positive, the urine should grow some organism.
Okay.
Alright, so these 2 tests will prove that it is urinary tract infection. Ascending or not, that will be depending upon the symptoms, general symptoms. Pulse is very high, high fever, low BP, dehydration. You feel the patient looks more sick, admit in the hospital. But treatment is the same, giving antibiotics as per the culture report. You have to give antibiotics. You may have to give IV antibiotics, or you can give oral, depending on what the organism is and what drug is acting against it. If that drug is available only in injection form, you have to give injection. So if you have to give injections, you may have to admit a patient for a few days. Otherwise, the patient can take OPD treatment. They have to take a lot of fluid, and you have to give alkalinizer, urine alkalinizer, which is called urilizer or cital. These liquids are there, which are sodium citrate or potassium citrate, which change the urine from acidic urine to alkaline urine, and then that burning goes away. Burning is because acidity in the urine causes burning. So to treat the burning, you can give this.
Okay.
If it's a bladder tumor, you can do a cystoscopy, and if it is small, you can remove it just like with the equipment you remove TURP, with the same equipment with the electric current, you can remove the bladder tumor. Okay, maybe there are one or two. So you remove the bladder tumor like this. Then you send it for examination. Now in examination, in a bladder tumor, they will tell you what is the grade of malignancy, 1, 2 or 3, high grade or low grade. But more important, they will tell you what is the depth of the tumor, because in a bladder tumor, you have to know whether the tumor is superficial, it is only in the inner layer of the bladder, or it has gone to the outer layer of the bladder, which is the muscle layer. Once it goes into the muscle layer, then obviously you cannot remove it without making a puncture in the bladder, which means that you cannot now only remove the tumor through a telescope. So the deeper layers are affected, then you have to go to remove the whole bladder. So it's a big surgery which is called radical cystectomy. Just like you do radical prostate surgery, you remove the bladder completely. And then what you do is you take a loop of intestine, separate it with its blood supply, and then join the rest of the intestine so the food can go. And this separated loop of intestine, close it at one end, bring it out from the other end, and then the bladder ka jo 2 tubes are there which are bringing the urine, you put it into the loop. So the urine will keep flowing into a bag, which is known as urinary diversion. So the treatment for deeper layers of bladder cancer is radical cystectomy and urinary diversion. Now one thing I forgot to say, after you remove superficial tumor, you can inject either mitomycin C, which is a locally acting anti-cancer drug, or you can use BCG. You know this injection BCG we give? So you get a medical grade BCG which is of higher strength, which can inject in the bladder. The idea is that somehow the BCG creates a very severe local immune response, and it gets a lot of the antibody generating cells, the T and B cells, into the bladder locally, and those can counter the cancer cells. So the protocol is for early or superficial bladder cancer, you need to remove it and then give an injection of mitomycin C. If there is a recurrence, again you do this. If there is a third time recurrence, you can use BCG. And if suppose after some 1 or 2 recurrences, what happens each time, the bladder cancer can go deeper and deeper. At some stage, most of these bladder cancers which you have been able to manage only by doing the resection through the scope end up with cystectomy. One word on cancer of the kidney, which can also come as hematuria. So the best investigation for that is to do a CT uro. That means you inject a dye, like the same dye you use for strictured urethra, inject it and then do a CT scan. It will show you the cancer of the kidney. Now the cancer of the kidney again has got a stage. It could be restricted to the kidney, it could be restricted to the surrounding tissue or the fat surrounding the kidney, or it could spread to the other organs through the blood. The main renal vein, the blood clot, the tumor goes through that and goes into the rest of the body. The best treatment for cancer of kidney is also to remove the kidney. It is called radical nephrectomy. Other treatments are to give chemo and hormonal therapy. Okay, so if you find that there is no bladder tumor on ultrasound. Ultrasound is the primary investigation when there is blood in the urine. If you don't find a stone and you don't find a tumor, then it is necessary to do a CT uro next thing, because you want to rule out the malignancy of the kidney. Of course, ultrasound can also show you a tumor. So ultrasound will show you a tumor, but a CT uro will define it better. And then you can go for treating the kidney tumor, which is to do a surgery along with chemo and hormonal therapy. Okay, so this is in brief about blood in the urine. So especially if it is painless blood in the urine, you must go immediately to a doctor and get it evaluated, because it generally indicates malignancy.
Understood.
If it has got pain, of course it means stone and infection. So it can be If it is a stone, you will remove the stone. If it is infection, you treat with antibiotics.
Cool. Thank you so much, doctor.
Okay.
So, any queries, anything that you want to share, let us know in the comment section. Subscribe to our channel, like our video, share with your family and friends, and stay tuned for more interesting conditions and everything about the surgery part of it. So, stay tuned and see you again.